The services of consultant obstetricians, general practitioners, midwives at home and in hospital, health visitors and other social workers are provided by the National Health Service for all expectant mothers, as well as free dental treatment, maternity grants and allowances. The usual procedure is for the mother-to-be, and possibly her husband, to visit her general practitioner when she has missed a couple of periods, and he will probably confirm the pregnancy, giving the all-important date when baby can be expected to arrive, and advice on the appropriate antenatal care and place of confinement, depending on the health and social circumstances of the mother and the facilities available in the area. Whether the mother has her baby at home or in hospital, the standards of antenatal care in this country are high. In this film, the care given in the antenatal clinic of the Luton and Dunstable Hospital maternity wing is shown, but wherever it takes place, the pattern is similar. After the initial visit to doctor's surgery, he will arrange with the hospital for an appointment to be sent for the mother to attend the clinic. An appointment is given for each visit. The nearer to the correct time you arrive, the less waiting will be necessary. Once in 4 weeks is usually adequate for examinations in the early months. This shortens to every 2 weeks from 28 weeks, and towards the end we like to see you every week. You're given a new appointment at each visit, but should you be worried in any way at any time, contact your own doctor or ring the clinic for an earlier appointment. Some form filling is necessary with new patients. In the notes the clerk is preparing, every detail of your health and progress during pregnancy will eventually be recorded. After reporting to the reception desk, you take a seat in the waiting area. When it is your turn, Sister calls you through to the clinic. On your first visit, an experienced midwife, often accompanied by a student midwife, will ask a number of questions. Particulars about yourself, your family, and any previous illnesses or operations are recorded, because these may have some influence on the progress of your pregnancy. The more complete the picture that we can build up of your life before pregnancy and during the first few vital weeks, the better equipped we shall be to take good care of you and your baby. Don't hold anything back because you think it's unimportant. If you remember anything after your first visit, write it down and tell Sister at your next visit. In the early months of pregnancy, changes are happening in your body, such as stopping of periods, morning sickness, feelings of depression. These are due to increased hormone activity. If you have any anxieties about these or other problems, do ask advice from one of the midwives. Height is measured. Height can help doctor in assessing the size of your bony pelvis, the passage through which the baby must pass in labor. You will be asked to produce a specimen of urine at each visit. This specimen is passed through the hatch to a nurse who carries out a simple but important test. A piece of test material is dipped into a sample and is checked against a color indicator. This test is necessary because it helps us to keep a check on your kidney function. The kidneys have extra work to do in pregnancy, and if there's any sign of strain or a minor infection developing, the test will reveal these in good time so that prompt treatment can be given. During your pregnancy, an adequate intake of fluid, the equivalent of 6 to 8 glasses a day, will keep your kidneys functioning properly. A midwife will show you into an examination room where you will be asked to get undressed. Although it is necessary to remove most of your clothes, you do in fact keep your slip on. Weight and height give us a good idea of your general build, so that we can assess weight gain accurately throughout your pregnancy. Estimation of blood pressure is carried out regularly at each visit, and is yet another way to tell that everything is progressing satisfactorily. Nurse will inquire about your general health, your appetite, how well you sleep and feel, and will give you advice about any minor discomforts. Early in pregnancy, doctor will carry out a full medical examination just to make certain that you're as fit as possible to carry your baby. He'll count your pulse rate, listen to your heart and lungs, and ask you quite a lot of questions. Later, at the 36th week of your pregnancy, he'll see you again. And as well as a further assessment of your general health, he'll make sure that the baby is lying in a good position, and by external and possibly internal examinations, ascertain that there's plenty of room for baby to pass through the bony canal of your pelvis. At visits to the clinic in the later stages of your pregnancy, a midwife will examine your abdomen carefully to assess the growth and position of baby, and she will listen to the sound of baby's heartbeat. It is usual for the first faint movements to be felt just before the middle of pregnancy, about the 18th week. You may mistake this for wind until it recurs. It's a useful date to note down, as it helps us to establish the length of your pregnancy, if there's been any doubt about your dates. In the blood room, a sample of your blood will be taken. This is a simple prick in the finger for a check of your percentage of hemoglobin. But when complete laboratory tests are required, as at your first visit, more blood is needed, and so a sample is taken from a vein in the forearm. Only a small amount is withdrawn. The body contains 8 to 10 pints, so a little is not missed. This sample will now be sent to the pathology laboratory for examination. From it, a lot of information will be gained. For example, the blood group can be determined, the Rh factor checked, and an estimation of the strength is also made to see if you're at all anemic. Anemia can occur in pregnancy due to the needs of the growing baby. Every mother should take care to eat all the foods necessary for the maintenance of her own health and that of the baby. At least 2 pints of milk a day, plenty of fresh fruit and vegetables, as well as meat, fish, cheese and eggs are advisable. And when necessary, extra iron in tablet form will be supplied.